So we have Johns Hopkins develops Epic embedded tool to better support telehealth patients. I found this one interesting. I'll give a couple of the excerpts. So it talks about the tool. Johns Hopkins Medicine developed a tool aimed to automatically identify patients likely to need telehealth technical assistance. According to an editorial in the Harvard Business Review by 4 members of the Johns Hopkins teams, the tool is embedded in the Epic EHR. The tool can be used by either central IT support team or frontline clinicians. And what it does is it creates a score. So the score, which increases based on the risk a video visit will be unsuccessful, is based on patients' digital health interactions, such as the patients not having an active account in MyChart, not having completed the system's each check-in process in the previous 7 days, and not having had a video visit appointment in the past 3 months. The score is automatically calculated based on stored EHR data and displayed as a column that can be added to a provider's or clinic staff members' scheduled views. And that's also in the articles. Interesting use of technology, interesting use of building out the algorithm. You selected this story, so I'm curious, what are your thoughts on it?
Well, I thought the use case was really interesting. I was thrilled that they were doing this kind of segmentation, because when I was working with healthcare and hospitals, there wasn't that idea of like different types of patients. So I loved the fact that they were identifying that. What concerned me a little bit was there are good reasons why somebody doesn't have an account in MyChart.
Right.
That was one thing. And then the other was, how much effort did they put into this as opposed to making the telemedicine visits like really seamless and easy? So the beginning, or I guess about a year and a half ago, I was doing some consulting and I did a bunch of research with seniors on communication and how they talk to their adult children and the adult children and how they talk to the seniors and stuff. And this was at the very beginning of the pandemic. The seniors I was talking to were, granted, they were high functioning, but they were doing Zoom presentations for travel slideshows instead of going to the community center. And they had picked that up. And so I, on the one hand, love the idea of segmenting your users and understanding that they're not all the same and they're going to need varying levels of help. And in fact, that it looks like they reacted because they were trying to provide this help to everyone. And some people were like, go stuff it. Like, I think I can do this.
Right.
You're interrupting my business day where I'm on Zoom all day. I can do this stuff. But, you kind of want to look at what are they also doing to make the telemedicine process easy, not just this sort of it seemed a little bit of the, let's not waste, you don't want to waste the clinician's time, but let's make sure everybody shows up for their visit. And I love that aspect of it and the idea that people have differing needs, but I also would like to see what are they learning that is actually improving the telemedicine process.